let's start the next topic, regressive alterations of teeth. Reducing lesion, reducing. Regressive means reducing lesions taking place in retrograde manner, a destructive manner, related to maybe age, trauma, physiological or pathological conditions. First is adhesion, physiological loss of tooth substance. Enamel is destroyed more. Enamel is lost more than dentine because of tooth to tooth contact. Because of tooth adhesion occurs function or and due to function or parafunction. This is a facet we have all seen, like it is semicircle or in depth, and flattening is like whole the surface is flattened. The it is You can imagine a facet in molars and posterior teeth, and flattening in anterior teeth. You have seen if you have done the internship. Severe cases, pulpal exposure. Severe cases, pulpal exposure, most common dental hypersensitivity. In severe cases, pulp get exposed. Most common dentine hypersensitivity. Most common complaint. Conditions associated, most common is bruxism. Okay, now abrasion, pathological wear, loss of tooth substance abnormal due to some abnormal mechanical substance, loss of substance, mechanical substance like in toothpaste and all, due to like a faulty brushing technique or dentifrice containing high amount of abrasives. Okay, seen in cervical third at corner of the mouth, canine and premolar, and also associated habits holding pins in mouth, a bobby pin defect, and seen in parallel valley and carpenters. Okay, or some people have habit of doing like their nails on the maxillary central incisors, like rubbing it to their rubbing their hand nails to their maxillary central incisors. So this defect can occur. Okay, now this is the corner of the mouth valley problem, like toothbrushing, faulty brushing technique. The right-handed persons apply more force on left-handed. So yes, we have to remember कि left-handed person apply more force on right side, and right-handed person apply more force on left side. So most commonly we all are right-handed, so most common cases in OPD comes of left-handed abrasion. Left canine and premolar maxillary abraded. Now erosion, loss of tooth substance because of chemical substance, acid, not bacteria. It is not bacteria, but it is an acid. It is divided into two categories, external and internal. In external cases, dried citrus fruits, carbonated drinks, and sport drinks. We can see external in buccal and labial surfaces, because we chew and it goes on buccal surface and labial surfaces, gets increase affected. And in case of internal, GERD, vomiting, bulimia nervosa, which has bulimia nervosa was Diana Queen. Princess Diana was suffering from bulimia nervosa, so she must have internal, like palatal and perimyelitis, palatal and lingual surfaces affected, because the vomiting come in our mouth oral cavity, and it will cover the palate first and lingual surfaces, and will not go to the buccal surfaces, because if it comes in our comes or GRD occurs, it comes either we vomit it out, or not shake it in our mouth. We will not do it. You are getting my point. It is okay, my sense of humor is not good, but you can imagine it's very you so fancy. Okay, I have to make it like fuck your loss of substance. I know this is not gonna be seen by YouTubers, no views. I hope no one will get No one will have to see this. Okay, loss of substance due to gastric juices called बहुत हो गई बकवास. Loss of substance due to gastric juices called perimyelitis, internal, palatal or lingual surfaces. Now you can imagine, okay, how palatal and lingual surfaces are destroyed in internal or GERD or vomiting cases. Okay, now in severe cases of erosion, entire buccal cusp is lost. Entire buccal cusp, lingual cusp, this is CJ buccal cusp, and ski slope effect. This is known as ski slope effect. Cusping erosion. Okay, cusping erosion is like this: raised enamel. If active erosion, surface will be unstained and clean. If active erosion is taking place, then the surface will be unstained and clean. And if passive erosion, in case of passive erosion, inactive, darkly stained surface. Okay, now abfraction. Oh my god. Now abfraction. Ab away. Ab means away, and fraction means fraction of the tooth going away. So abfraction means fraction of the tooth going away. Mimics abrasion. It mimics abrasion, but it is not abrasion. It is due to under occlusion or compressive or tensile forces, biomechanical loading forces. Forces act at the cervical third, so behaves like fulcrum. It behaves like fulcrum. This is like a wedge shaped effect. And similarity is between abfraction and abrasion is that pathological plus cervical third seen in premolars. Pathological, both are seen in premolars, and both are pathological, and both are occurs in cervical third. Okay, now difference is like seen in abrasion is seen in canine and premolars, because at corner of the mouth we do hard brushing, and abfraction is seen on premolars and molars. Okay, abrasion involves 2 to 3 teeth together. Abrasion involves 2 to 3 teeth together. Okay, and abfraction involves 1 to 2 teeth together. Restoration, in case of abrasion, restoration in cervical third, only surface is abraded. In abrasion case, we do brushing and then only the surface of restoration is abraded. But in abfraction, due to force, it gets separated to the tooth. The restoration gets separated from the tooth, so it will in toto it will come out, the restoration whole separated from the tooth. Restoration will be dislodged. Okay, dislodge is the word. Okay, now abrasion is supragingival, and not always, but mostly it is supragingival, and it is abfraction is subgingival. Okay, now sclerotic dentine or secondary dentine or and dead tracts. Calcification of dentinal tubules due to trauma, stimulus, or caries, etc. Refractive index of dentinal tubule surrounding dentine is equalized, appear as transparent. Refractive index of dentinal tubules and surrounding dentine is equalized. Okay, with increasing age, increased sclerosis. Okay, dead tracts are empty dentinal tract filled with tubules filled with air. Preceding step for sclerotic dentine. Dead tracts occur before sclerotic dentine. This is a dead tract and it occurs before, because it is up. This is how we can remember, because it is up, it occurs before, and then sclerotic dentine will form. Okay, it appears dark in transmitted light. Okay, now secondary dentine formed after root completion. It formed after root completion. Secondary dentine, physiological secondary dentine, and reparative or tertiary secondary dentine or tertiary dentine. Now physiologic is irregular arrangement of due to irregular arrangement of dentinal tubules. Less dentinal tubules in number, and spread of caries is slow in case of physiological secondary dentine. Okay, in case of reparative secondary dentine or tertiary dentine is divided into two types: reactionary tertiary dentine and reparative tertiary dentine. Okay, reactionary is pre-existing odontoblast is present, which forms tertiary dentine. Reactionary tertiary dentine is pre-existing odontoblast which forms tertiary dentine. And tertiary dentine is undifferentiated cells of pulp will differentiate into new odontoblast. Form repetitive dentine. Undifferentiated cells which are present in pulp will differentiate into new odontoblast and will form reparative dentine. Okay, now pulp classification. My god. Pulp classification: discrete pulp stones and pulp nodules, free, attached, embedded. Free is present freely in pulp, attached in between, and embedded in interstitial in dentine. Okay. Now diffuse degenerated products, dead cells. Diffuse degenerated products, dead cell, blood vessels, and calcification due to dead these. Okay. Present. Okay, now further divided into true and false. True contain dentinal tubules or structures in tubule is tubular. True denticles are contain dentinal tubules or structure in tubules. False denticles are not tubular. Okay, simple. Resorption of dentine, physiological and pathological. So roots of primary teeth. Physiological roots of primary teeth resorbed. Pathological external and internal. External tooth resorption. External tooth resorption is like in case of periapical inflammation, implantation of tooth, tumor and cyst, excessive mechanical or occlusal forces, trauma from occlusion causes first resorption, then hypercementosis. This is we have to remember. Then impaction of teeth and idiopathic resorption. Internal resorption of teeth are chronic perforating hyperplasia of pulp. Okay. Internal resorption of teeth is also known as chronic perforating hyperplasia of pulp and internal granuloma or misnomer granulation tissue, odontoclastoma or pink tooth of murmury, hyperplasia of pulp, granulation tissue inflamed. Pulp is rich in multinucleated giant cells and osteoclasts. Increased pulp chamber multinucleated giant cells, these are osteoclasts. Okay, multinucleated giant cells are composed of osteoclasts. Resorption of dentine, which causes resorption of dentine from inside, and scalloped border formed here, and osteoclast presence similar to osteoclast. Treatment is RCT or extraction. Okay, now hypercementosis or cemental hyperplasia, localized or generalized is most common, seen in chronic periapical inflammation, blunting of root apex. Opposite or antagonist tooth missing, opposite or antagonist tooth is missing, supra eruption because of a hypercementosis. Non-functional tooth, trauma from occlusion, increased occlusal forces, seen in cemental resorption, not under force, hypercementosis, and generalized or like metabolic disease. Cellular cementum form in hypercementosis, which is also called as secondary cementum. Paget's disease, increased alkaline phosphate, 250 Bernowski unit. Hyperphosphatemia, decreased phosphate, which is no cementum is formed in this case. Now cementicles. Small size calcification seen in PDL. Small size calcification seen in PDL because of calcification of epithelial rest of malaise or calcification around dead RBC, WBC or thrombosed blood vessels. Fragments of cementum torn and seen in PDL. Fragments of cementum torn and seen in PDL called as cemental tears, sometimes due to increased occlusal forces, cemental spikes or excementosis. Okay, now free, these are also further divided into free, attached and embedded. Free in PDL, attached in PDL plus cementum, in between PDL plus cementum, and embedded in cementum, secondary cementum. Okay, this is now our completed this chapter.